This is a patient of mine who just came in today, and I haven't seen her for, how long, about a year?
No, it's been 5 years.
5 years? Wow, time goes fast. But anyway, she's a triathlete. She's a runner. She puts a lot of time into training and doing these events. And she came in today because she started for a long run, and she came in. What was your issue?
I actually was doing a 6-mile run, and within a couple of miles, right away my back and lower back and all back here started getting really tight and hurt during the run. And actually some things through here, so I had to quit after a while. I did the whole 6, but...
That's what brought you into my office?
Yes.
Okay. So this young lady's come into my office, and she has a problem with her hip. But we don't just look at the hip in this office. We practice neurology here, and we practice kinesiology, so we are trained actually to look at the whole picture of why she's having problems. So initially we're going to have her just stand here with your feet close together. And we're just going to have her stand relaxed, and I would like you to see what actually is going to portray here, what's happening with her. And you can see she's swaying quite a bit. And she doesn't have an acoustic neuroma. She doesn't have a brainstem tumor. She doesn't have any diseases. She has functional imbalances that are actually creating these problems. So her stability is bad. Now we're going to have her close her eyes. So you can see, and you didn't even know you had this problem, did you? So her balance is off. We find this a lot with people. So if her balance and stability is bad with her eyes open, and then we close her eyes, it shows that she's having improper proprioception coming back from her low extremities. And she actually has deafferentation in her 1A afferent fibers firing back into her brainstem, which is not activating her balance centers, her vestibular system, and her reticular formation, which actually strengthens all this. And because of that, she's starting to have pain. Pain is a symptom. It's not the cause of the problem. Hold your hands out like this. And just wiggle your fingers fast for me. So her left hand's starting to slow down. Stop it. You can see her thumbs are starting to point down more too, which means she is having more uninhibited flexion. So she's getting more flexor tonus, she's getting more reticular formation weakness, which is causing her extensors to weaken, and she's starting to have pain and running. And it's also going to cause problems with her performance. And so what we're going to do in this office is bring her back into balance using techniques we have to stimulate this. And I'm also going to show how it weakens her muscles. Let's have you lie on the table here. Face up, please. So I'm going to have you bring a leg up. And again, here, ablative lesions have been ruled out. She does not have that. She has somatomotor weakness, but it's due to decreased firing of the reticular formation. So hold this up. I'm going to push down. That's the same side as you're having the burning pain on, isn't it? So now hold this up and don't let me push down. So it's an ipsilateral problem. So ipsilaterally, she's going to be weaker on this whole side. Hold this out. I'm going to push in. And hold this out. And her lat is an extensor muscle too, so we're going to test this. I'm going to pull out, try and hold it.
How much time do you need?
You having trouble opening things with this wrist or holding on? You know this? Hold your hand back. I'm going to push down, try and hold it there. Getting writer's cramp if you have to write a lot or anything like that. Hold this hand back. So you can see her extensor muscles on this side are not firing right. They're shut down. And then she's going to get uninhibited flexion. So she's going to get a lot of tightness up in your shoulder up here. Hamstring get tight.
Yes.
And then they start having Achilles tendon problems too.
Yes.
And then they start having plantar fasciitis. So a big problem with plantar fasciitis is not it's not just the foot or that they have an orthotic deficiency. It's actually a problem with uninhibited flexion causing pulling on the foot all the time. And then this will start creating more problems in her neck. She'll get more angulation in this side in her shoulder. And this foot will turn out more because she's got weakness here. So if we test her peroneus muscles on this side, point your foot down, turn it out to the right. I'm going to push down and in, you hold it there. And she just has no strength, so she's going to get soreness in here and here. Then because of the unopposed flexion on this side, you actually get a bicep tendon that slips. Has this arm been bugging you too?
Yeah, the whole...
Does this buggy a little
Yeah.
bit.
Sore.
And then your back muscles will start getting very sore, and because of the decreased rate of firing their extensors in her back also. So we start to get a global effect here that's creating weakness, and so for an athlete, they can't run, their ability to perform decreases, and pretty soon they start having a lot of inflammation in their body. And now when you fire these NASA receptors back to the brain, it inhibits actually the 1A afferents firing back, which is going to cause more weakness, and you start to just get this negative feedback situation going on, and it doesn't get fixed until you do the things we're going to do in our office, and we're going to show you some of that. She also, if you look at her pupil, we've looked at them already. This pupil on this side doesn't hold. It has a little more hippus. It fails faster. And if we check her peripheral perfusion on this side compared to the other side, from what I know about this situation, it should be less, but we're just going to check it. We got like 0.24 on this side. Actually, it's fairly equal on both sides. It's low on both sides. So anyway, what we're going to do with this young lady to fix, let's cut it off right now, and then we'll do the other.